One of the great challenges in health and healthcare in general is that a lot of people have what I call, they'll get New Year's syndrome. It's January 1st, I'm going to make a commitment, I'm going to make a pledge that I'm going to lose 50 pounds, I'm going to exercise every day, I'm going to get rid of my stress, I'm going to do all that. And by human nature, we're inertial beings. Once we're doing something, we stay doing it until a significant outside force shifts that. And in our current healthcare system, there is nobody really there for the client or the consumer or the patient, whatever you'd like to call them, that really helps them get past the initial excitement and flurry that happens in the first 4 weeks after you make a pledge, and really move into how do we sustain real meaningful change in our lifestyle and our beliefs and in our behaviors. And most psychologic studies, a lot of what we know about human behavior really lets us know that you have to entrench a new habit, a new pattern of being, whether that's a belief or behavior, for at least 100 days. Some studies are leaning more towards 6 months, before that really becomes a part of who you are and how you live, rather than just something you're doing for a while. Which is why the perpetual cycle of diet, lose weight, gain weight goes on over and over for people, because they think of something they're doing for a while, and then they're going to stop doing their diet, and they go back to the way they used to live. And healthcare professionals on the whole, and I can speak as someone who is trained that way, we're not trained in understanding change behavior, change sustainability. And so in order to really achieve lasting, meaningful, people evolving to be different kinds of beings in their life, we need somebody that can help them do that. And I really see that being the role of both individual practitioners and also the role of some of the philosophies and practices of health coaching in contemporary healthcare is that what do we really understand about human behavior change, about the readiness for it, about what's needed to make it sustainable, and what's needed to really have people incorporate it into the fabric of their being. And I really think that that's one of the great gifts that coaches in healthcare can bring to what right now is a system that's really not serving our population very well, as can be spoken to our epidemics of obesity and diabetes. But so I think that that's a really important piece.